Spinal stenosis is a condition we treat in our office. Stenosis by definition means narrowing. So anytime the spinal column gets crowded by either disc material, by the ligaments becoming more broad, it can narrow and compress or irritate the delicate nerve tissue. Another way is as the disc starts to deteriorate and desiccate and dry out, what happens is it gets thinner and thinner, and the spacing between the bones gets less and less. This can happen in the foramina, which is the outer hole, or it can happen centrally where the hole with the spinal cord is. And this causes a lot of pain. Now, we tend to see this more often in elderly people because as their spine deteriorates over time, it starts to crowd and make that area much smaller and more narrow. But it can also occur with patients that have severe disc injuries. Patients that have huge bulging discs or herniations, or a lot of bone spurring, which is where the bone starts to actually lip and spur and starts to grow outward, and can irritate the delicate nerve tissue or disc material. It also creates a lot of inflammation. Now, with spinal stenosis comes a lot of decreased mobility, a lot of stiffness. It's difficult getting around for these patients because of the stenosis or narrowing of the spinal column.